Hello everyone, my name is Dr. Aashish Jain. I'm a physical therapist, associate professor with Mahatma Gandhi Physiotherapy College, a constituent college of Mahatma Gandhi University of Medical Sciences and Technology, Jaipur. So today we'll discuss about injury prevention, how to prevent the injury and what is the importance of injury prevention. Let's see what actually is injury prevention. These are the measures that are being taken in order to reduce the chances of injury or the incidence of injury, and also to reduce the amount of injury, the severity we can reduce. It basically focuses on the implementation of safety promotion measures. For example, we see certain sort of tapings that athletes wear to prevent the injury of the predisposed area. Now it also uses the effort to provide a safer environment as well as on how to tackle the risk taking behaviors, means how a person can cope up, how he can build the resilience to avoid certain sort of injuries. Now if we broadly divide these sports injury prevention strategies, that will be into three parts. First of all, it is a primary prevention, which is the prevention which we do before any occurrence of the injury. For example, like you must have seen people wearing knee braces, certain sort of elbow braces, wearing tapes. These all comes into the primary prevention strategies. Second one is the secondary prevention. In second prevention, it happens after the injury. As soon as the injuries occurred, in order to reduce the severity of injury or to reduce any further complication which are to be seen on the later stages, what we do is we go for certain protocols. That the latest updated is the peace therapy, where we do we try to manage and we try to reduce the injury and stop it from becoming a bigger injury. Then comes the tertiary management or tertiary prevention. In tertiary prevention, what we do is we rehab the person. It also occurs after the injury. What we do is we rehab the person and we prevent the further complications that are to be seen on the later stages. Now for the injury prevention, we have a whole scheme or whole schematic presentation that I have. See, first we notice the extent of injury, how big it is, what is the area involved, how then we establish the reason of the injury. Was the knee twisted? Was the shoulder gone into certain external rotation or the excess range of motion? Was it abrasion? Was there a landing injury? Was it a hit injury or direct trauma? So we establish the etiology and mechanism of the injury. Based on that, we devise with the preventive measures what are to be taken in the particular sport. For example, I am playing football. There are chances that my ankle get twisted, or as we see, the most of the injuries in is ACL in football. So or the hamstring injuries. So what we do is we reduce the chances of injury by taking the preventive measures and working on the resilience of hamstrings or the ACL. Then after the introduction of the preventive measures, what we do is we assess its effectiveness. Like suppose I did taping on the particular area. So is the taping effective? Is it reducing the chances of injury? Is it mitigating the risk of injury? So we reassess its effectiveness and we go to the first one again, which is the noticing the extent of injury. Was it reduced or was it the same? So we come to know that this particular preventive measures work or doesn't work. Like for example, Nordic hamstrings, it's widely used in hamstring protocols as a preventive measure. So that is being done by scientific studies. Okay. So next is knowing the factors responsible for the injury. See, we have discussed the schematics. We have discussed various parts of injury prevention. Now we'll move on to the factors responsible for injury prevention. For example, now we start with the internal risk factors. The internal risk factors can be age, can be gender, which cannot be modified, which are in your body. it can be your body composition, it can be your skill level, it can be your anatomical things, it can be your physical fitness, it can be your health. Then second one are the external factors. If you are predisposed to the internal factors, if you have something different, I can say, in your internal factors. For example, we take age. An older athlete is always susceptible to injury, as the younger athlete is not in certain sports. It can be gender, and we have seen in certain sports gender plays an important role. In certain sports, female athletes are more predisposed, and in certain sports male athletes are predisposed. So apart from the internal risk factors, we move on to the external risk factors. Now, external risk factors, it can be the environment, it can be the protective equipment that a person is using, it can be the sport equipment, it can be human factors. For example, now if in rugby a player tackles you and you fall on the ground, it can cause injury. It is the human factor. It can be protective equipment. Suppose if you are not wearing helmet and you are on the field and some ball or something hits on your head, it can cause concussion or any other injury. Again, it is the protective equipment role. Next is the sports equipment. If you are not using proper racket in racket sport, it can also cause over trauma or overuse injuries. In environment factors, in certain humid environments, if you are not drinking properly, you are not taking your irons properly, it can also cause certain injuries. Now, if a person is predisposed to a particular injury, and if there is an inciting event which challenges you to, or challenges your muscular structures to its limit, it can cause the injury. Now, that inciting event will cause the injury, but the factors were present before. Now, to monitor or to know the injury, what we should know is we have to know the literature about the injury prevalence in that particular sport. For example, like I talked earlier,